Welcome to our channel. Today, we're diving into a crucial topic: hidden cries for help. How to spot and support suicidal loved ones. Depression affects millions worldwide, and understanding its deeper implications is essential in providing support. Understanding depression. Depression is more than just feeling sad. It's a profound and multifaceted mental health disorder that affects millions worldwide. It's not a temporary mood but a persistent condition that can profoundly impact every aspect of a person's life. At its core, depression is characterized by a persistent feeling of sadness or emptiness that doesn't seem to lift, even with the passage of time. This emotional burden can be overwhelming and lead to a loss of interest or pleasure in activities that were once enjoyable. Alongside emotional changes, depression often disrupts basic biological functions, such as appetite and sleep. Some may experience significant changes, like overeating or insomnia, while others may lose interest in food and struggle with excessive sleeping. It's important to recognize that depression isn't just a matter of feeling down for a few days. It's a persistent condition that can last for weeks, months, or even years if left untreated. This prolonged state of emotional distress can make it challenging for individuals to function normally at work, school, or in their personal relationships. Understanding these complexities of depression is crucial because it forms the foundation for recognizing when someone might be at risk for suicidal thoughts or behaviors. Next, we'll explore how untreated depression can escalate to suicidal tendencies and what signs to look for. From depression to suicidal tendencies. When depression is left unmanaged, it can escalate into something far more dangerous: suicidal tendencies. This transition is a critical and life-threatening progression that we need to understand deeply. Depression, in its severe form, can lead to overwhelming feelings of hopelessness and despair. Individuals may start to feel like there's no way out of their pain, and these feelings can become so intense that they begin to consider suicide as a means to end their suffering. One of the key factors in this dangerous transition is the sense of hopelessness. This isn't just a passing thought, it's a deep, pervasive belief that things will never get better, that their situation is unchangeable, and that they are trapped in a cycle of unending pain. Despair also plays a significant role. Despair is a state where an individual feels utterly powerless and unable to see any positive future. This state can lead to feelings of worthlessness and self-blame, making the individual believe they are a burden to others. These intense emotional states can lead to the individual experiencing suicidal thoughts. They might begin to think about death frequently, make plans for suicide, or even attempt it. It's crucial to understand that these thoughts and behaviors are not signs of weakness or attention-seeking. They are symptoms of a severe mental health crisis that requires immediate intervention. It's important to recognize that not everyone with depression will develop suicidal tendencies. However, those who do are often battling an inner turmoil that feels unbearable. The transition from depression to suicidal tendencies is marked by a significant increase in the intensity and frequency of these distressing thoughts and feelings. Understanding this transition can help us identify when someone we care about is moving from depression to a more dangerous state. It's a critical step in providing the right support and intervention to prevent a tragic outcome. Signs of suicidal tendencies versus depression. Next, we will explore how can we provide support to our loved ones. Recognizing the signs of suicidal tendencies is just the first step. Taking action to support your loved one is crucial and can make all the difference. Here are some essential steps you can take. Empathize. One of the most important things you can do is to create a safe space for them to express their feelings without fear of judgment or criticism. Listen with empathy and compassion. Sometimes, just knowing that someone is there to listen can provide immense relief. Offer support. Encourage them to seek professional help. This could mean finding a therapist, psychiatrist, or counselor who specializes in depression and suicidal tendencies. Offer to accompany them to appointments or help them find resources. Knowing they have your support can give them the courage to seek the help they need. Remove means of self-harm. If you believe your loved one is at immediate risk of self-harm, it's essential to remove any potentially dangerous items from their environment. This includes securing firearms, medications, sharp objects, and any other items that could be used to inflict harm. Creating a safe environment can prevent impulsive actions. Stay connected. Let your loved one know that you are there for them, even if they push you away. Consistent, gentle check-ins can make them feel valued and less isolated. Whether it's a daily text, a phone call, or a visit, staying connected shows that you care and are there to support them. Educate yourself. Understanding more about depression and suicidal tendencies can help you provide better support. Learn about the condition, treatment options, and resources available. Being informed empowers you to offer meaningful help. Encourage positive activities. While it may be challenging, gently encourage them to engage in activities they once enjoyed or to try new, positive experiences. Activities like exercise, hobbies, or social events can help improve their mood and provide a sense of normalcy. Be patient. Recovery from depression and suicidal tendencies is not an overnight process. It requires time, patience, and continuous support. Avoid expressing frustration or disappointment if progress seems slow. Your understanding and patience are crucial. Encourage professional help. Remind them that seeking professional help is a sign of strength, not weakness. Offer to assist them in finding a mental health professional who they feel comfortable with. Know the emergency steps. Be aware of emergency steps if the situation escalates. This might include contacting a crisis hotline, taking them to an emergency room, or calling emergency services. Have a plan in place so you can act quickly if needed. Take care of yourself. Supporting a loved one through this challenging time can be emotionally draining. Ensure you are also taking care of your own mental health. Your well-being is important too. By taking these steps, you can make a significant impact on your loved one's life. Your support, understanding, and intervention can guide them towards the help they need and ultimately save their life. Remember, you are not alone in this. Reach out for help if you need it, and let's work together to support those we care about through their darkest times.